Those kind of things.
But
Yeah.
so how has your assignment in Kenya been like? What's your experience?
It was actually a very positive experience. I had worked in Kenya before in the immunization program in WHO, but this was my first assignment as a WHO representative. And working with the Ministry of Health and the partners here, it was a positive experience.
Dr. Rudi Eggers has been the World Health Organization representative in Kenya for the last 5 years. My name is Dr. Mercy Korir, and on this episode of Doctor's Diary, I sit down with Dr. Eggers as he winds up his assignment in Kenya. We talk about his achievements for the last 5 years, what he thinks of Kenya's health system, and the next steps for Kenya in the health sector.
I have 4 children, and my third daughter is actually studying to become a medical doctor. I don't know if she'll become a doctor that's also going to go into public health. At the moment, she's more interested in clinical work, and we will have to see. The other children take after me in other aspects, but not in medical.
Starting in South Africa, Dr. Rudi Eggers has been with the World Health Organization for the last 22 years. His career in public health started at the National Department of Health in South Africa as the National Immunization Program Manager.
My mother's family came out of a medical background, so I've always known that there's some part of me that can work with people. So my medical interest came out of that direction. I had not believed that I would land in this kind of position, this public health position, when I first started. Of course, everybody that starts as a doctor wants to be a clinician, a person that treats sick people. But I actually found that being in public health was a very positive thing as well, because you can influence not only the health of an individual or treat an individual, but really make sure that a community or indeed a nation actually can be healthy or healthier than they were. So working with policies and institutions and governments really enables that concept of getting people healthy to be expanded beyond the individual.
Trained in the University of Pretoria as a medical doctor, Dr. Rudi's initial career plan and how his life has turned out, he says, is different, but that it has worked out.
I did my clinical training there, and also worked in clinical departments after that, both in South Africa and in Canada. And then with time noticed that I had some interest also in research and in epidemiology and also in public health. So with the time I actually got involved in the immunization program in South Africa. I was actually the immunization program manager in South Africa for a while, and through that really got to know public health. I did my specialization also in South Africa in community health, and that way got into contact with WHO and developed my career in WHO.
5 years ago, when Dr. Rudi Eggers became Kenya's WHO representative, the major health concerns were at the time infectious diseases causing diarrhea and upper respiratory tract infections, mainly in children, undernutrition, maternal and child health, low immunization threat with the threat of measles and polio looming, and finally the geographic and economic constraints of access to health. Nobody saw the COVID-19 pandemic coming. His entry at the time was full and wider than the immunization-only program that he worked in. The strategy was clear: to coordinate and provide support for Kenyans to improve their state of health. At the World Health Organization, the outlook changes from a national to an international perspective, but the mandate is not without its own challenges.
I think being in WHO, you don't have the final deciding step. We are in support of governments, so you don't have the ability to finally implement, and that to some extent is our disadvantage. We don't have that power to implement. We do have a very strong technical advisory power, and we've got the ability to bring together, to convene experts or knowledgeable people and present them to the considerations that are being done by government. So the strongest point where I would have hoped to engage more is really in the implementation. Ultimately, that's a government function, and it is rightly so. It must be for the government who've got the responsibility given by the people to actually take the implementation forward. But that is really where WHO has to take a second step behind the implementers of government.
Rudi's Kenya assignment has seen him traverse different parts of the country, like in 2019 at the launch of the malaria vaccine in Thiwa Town, Homa Bay County, when Kenya became one of the 3 African countries to start the malaria vaccination for children.
What would you say is next for Kenya then, with the achievements and the things that you see have taken Kenya a step ahead or a step towards, for example, achieving universal health coverage, towards containing the pandemic? What do you think should be the next steps for Kenya?
I think there were 3 things I would highlight. The first thing is I hope that the universal coverage, universal health care does not stop, that it actually continues to its logical conclusion. So I hope with any coming government of whatever kind that gets further boost and further implementation so that can be completed. It is truly a very noble cause. It is something that really makes a difference in the health of people if that is actually brought to conclusion. So we would strongly stand behind that. The second part is, of course, we are still in the COVID era, and we are currently in the next surge of the epidemic. Kenya has to continue, like the rest of Africa, to vaccinate its people and to make sure that people don't continue to be infected. And as we stand at the moment, that's still quite a long way to go. So at least the next year, maybe the next year and a half, we will be dealing with this pandemic in the country. And that is the second agenda that we really have to achieve jointly in Kenya. The third part in Kenya is the system, the government system of national and counties and health being a devolved function. That has got a lot of advantages of making health a devolved function because it brings it closer to the people. But the ability of the national government and the county governments to work together towards the same goal is something that has to be strengthened further. So I think that is another area of work where WHO, through the intergovernmental forum work and the engagement with the Council of Governors and with individual counties, can actually develop the agenda to make sure that that devolved function of health really gets taken forward jointly with the national level. I think Kenya has got a lot of capacity. It's got a lot of people that know how to run the health systems, and it's got also a strong political will. So the fact that His Excellency President Kenyatta made universal health coverage one of his prime outcomes was a very positive step for health in Kenya. So being able to work in that environment here was very positive.
Okay. So you said this was your first assignment as a WHO representative. Was it any challenging? Was it any different from a previous assignment in immunization?
Yes, absolutely. I mean, in immunization, you have to deal with the technical knowledge and the technical information, and you have to be scientifically correct and evidence-based. As a representative, the main job is really to do a diplomatic type job, to engage with government and with other partners more on a diplomatic, on a representative level. And that I had to learn. It was something that was new to me, and I hope I did a good job. We'll have to talk to others to see if that was the case.
When Dr. Rudi applied to be a representative, he did not know that the job description would be different from the technical aspects of medicine that he was used to while working in the immunization program at the World Health Body.
As a representative, the main job is really to do a diplomatic type job, to engage with government and with other partners more on a diplomatic, on a representative level. And that I had to learn. It was something that was new to me, and I hope I did a good job. We'll have to talk to others to see if that was the case.
What would you say then have been your biggest achievements or the things that you are most proud of as the representative?
I think the biggest achievement has been to really help Kenya to think through the universal health coverage work. So when that announcement was made, it was of course a big step forward for Kenya, and WHO and other partners got heavily involved. In fact, we have had our Director General, Dr Tedros, here in Kenya to actually launch the UHC, and we were heavily involved in the support of the design. Of course, within Ministry of Health, there was a lot of knowledge as well, and health financing aspects that were well planned there. But I think that was the biggest achievement. The second part maybe has been this COVID outbreak. Of course, we're all in the middle of it still, and that has been quite a lot of work for the government and for WHO to actually keep Kenya on track for that. So that maybe is the second achievement, that we really have been able to support the Kenyan government and the Kenyan population in trying to meet the challenges of this outbreak.
When the COVID-19 pandemic struck, just like any other leader in the health sector, Dr. Rudi had to step up and support the government as much as possible in containing the spread of the virus. Be it in press conferences to update Kenyans on the unfolding situation, Dr. Rudi was present. When Kenya needed more COVID-19 kits, WHO was represented and at the forefront of this.
UNICEF used its strength in procurement and transport to bring the vaccines here to Kenya. And what we will be doing is taking them to the depots, both central and then regional depots, so that these can be further distributed and the vaccination campaign can start. The vaccination campaign will be targeting priority groups such as essential health workers and other workers and other population groups who might be most at risk.
The urgent need to ramp up vaccination to contain the COVID-19 pandemic has WHO, together with other partners like UNICEF, coming in to support government efforts to safeguard every Kenyan from the virus. As the first batch of the COVAX facility donated vaccines jetted into the country, Dr. Rudi and his team were present. Containing the pandemic still remains a major concern.
The war is not over. We are in the middle of the pandemic. That is why we have got the vaccines here. So we would like to continue on this fight. And we want you to continue with the support that you have given us. So thank you all so much. Thank you very much. We really appreciate what we are seeing here. Dr. Rudi Eggers from the World Health Organization.
Dr. Rudi's next assignment takes him higher up on the global stage.
Well, I've accepted a job in Geneva in WHO headquarters, so I'll remain in WHO and will be working in the area of integrated health services. So looking further at aspects of making sure that the quality of care is there, that the ability of health services are assessed and are of high quality across the world. So I'll be back in a more advisory role, a global advisory role, so that those guidelines and directions can then be implemented in countries such as Kenya.
If you were to pen a note to your successor, whoever is coming in next as WHO representative in Kenya, what would be in that note?
I think in that note would be Kenya is able to do astounding things if it really wants to, if there is the political will and the direction. So I would say to my successor, these big agenda items that Kenya has put on the health table should be taken forward. There's a lot of good things that have started, but they need to be continued.
And to Kenyans in regards to the COVID-19 pandemic, Dr. Rudi encourages everyone who can take the COVID-19 vaccine to do so.
Vaccines are going to be very important in the coming year in Kenya. The point about the vaccines, the COVID vaccines, of course, currently we're in a situation that there are not enough vaccines for everybody. But within time, the government is purchasing a lot of vaccines, so there will be a lot more vaccines available. And I would encourage all Kenyans that have got access to these vaccines to really take them. We've got good experience across the world now that the vaccines truly prevent severe disease and death. So across the world there's really been that feature that these vaccines are safe and they really make a difference. So as vaccines become available in Kenya, I think I would reinforce that message that Kenyans should really, if offered the vaccine, if they are in the priority group, they should take the vaccine. Coming from the vaccination program, I would like to take that further into the other vaccines as well. Kenya is still at risk of polio, of course. We've got some polio cases that occasionally come across the border from some of the neighbouring countries. And in the last couple of years, the measles coverage has also declined a bit. So we've just done a measles campaign. The real way to deal with these diseases is to make sure that the routine immunization coverage is high. So campaigns can be done, but at the end of the day, it's the routine coverage that makes a difference. So I would encourage Kenya to go in that direction.
Dr. Rudi says that his experience in Kenya was good, positive, and memorable. Even as he leaves and paves way for his successor, Kenya remains full of potential, he says, to get to achieving the kind of healthcare system that responds to the people's needs. Dr. Mercy Korir for Doctor's Diary, KTN News.